Food poisoning, also called foodborne illness, occurs when you consume contaminated food or drink. Symptoms can range from mild nausea to severe dehydration and organ damage. Bacteria like Salmonella, E. coli, and Listeria are common culprits of food poisoning. These microscopic organisms can be found in various foods, especially undercooked meats, unpasteurized dairy products, and contaminated vegetables. When ingested, they can cause symptoms ranging from mild stomach upset to severe gastrointestinal distress. Viruses such as Norovirus spread easily through contaminated food and surfaces. This virus is highly contagious and can be transmitted through improper hand washing, touching contaminated surfaces, or consuming infected food. Symptoms often include nausea, vomiting, and diarrhea, making it crucial to maintain good hygiene practices. Parasites like Giardia and Cryptosporidium can contaminate water sources. These parasites are often found in untreated or poorly treated water and can cause severe gastrointestinal issues. Drinking or swimming in contaminated water can lead to infections, highlighting the importance of ensuring safe and clean water sources. Toxins from bacteria like Staphylococcus aureus and Clostridium botulinum can cause severe illness. These toxins can be produced in improperly stored or handled food, leading to symptoms such as nausea, vomiting, and even paralysis in severe cases. Proper food safety measures are essential to prevent toxin-related illnesses. Proper food handling, cooking, and storage are essential to minimize contamination risks. This includes washing hands and surfaces regularly, cooking foods to their recommended temperatures, and storing perishable items in the refrigerator. By following these practices, we can significantly reduce the risk of foodborne illnesses and ensure our meals are safe to eat. Common symptoms of food poisoning include nausea, vomiting, diarrhea, and abdominal cramps. Severe cases may involve bloody diarrhea, dehydration, and neurological symptoms. Seek medical attention if symptoms are severe or persistent. Diagnosis often involves a physical exam and possibly a stool sample to identify the contaminant. Treatment focuses on symptom relief and maintaining proper hydration. This is essential to help your body recover from the effects of food poisoning. Drink plenty of fluids like water and electrolyte solutions to replace lost fluids and electrolytes. This helps prevent dehydration, which can worsen your condition. Start with bland foods such as plain rice, toast, and bananas. These are gentle on your stomach. Gradually reintroduce other foods as your symptoms improve. Over-the-counter medications can help alleviate symptoms like nausea and diarrhea. However, it's important to consult a doctor first to ensure they are safe for you. Rest is crucial for recovery. Your body needs time to fight off the infection and regain strength. Make sure to get plenty of sleep and avoid strenuous activities. Severe cases of food poisoning may require hospitalization. In such instances, intravenous fluids and medications are administered to manage symptoms and prevent complications. Always seek medical attention if symptoms persist or worsen. Preventing food poisoning is better than treating it. It's essential to take proactive steps to ensure the food you consume is safe and free from harmful contaminants. Wash hands thoroughly before and after handling food. This simple act can significantly reduce the risk of transferring bacteria and other pathogens to your meals. Cook meat, poultry, and seafood to recommended temperatures. Use a food thermometer to ensure they reach safe internal temperatures. Refrigerate perishable foods promptly to prevent bacterial growth. Use separate cutting boards for raw and ready-to-eat foods. This practice helps prevent cross-contamination, which can occur when bacteria from raw foods come into contact with foods that are ready to eat. Use safe water sources and wash fruits and vegetables thoroughly. Even produce that will be peeled should be washed to remove any lingering pesticides or bacteria. Purchase food from reputable sources. Check expiration dates and inspect packaging for any signs of damage or tampering. Be cautious with high-risk foods like raw meat and unpasteurized dairy. These items are more likely to contain harmful bacteria that can cause serious illness. When in doubt, throw it out. If food looks or smells off, it's better to be safe and discard it rather than risk food poisoning. Following these guidelines can protect you and others from food poisoning. By being vigilant and practicing good food safety habits, you can enjoy your meals with peace of mind, knowing they are safe to eat. Seek medical attention if you experience high fever, bloody diarrhea, or severe dehydration. Frequent vomiting, severe abdominal pain, and neurological symptoms also warrant medical care. If symptoms persist for more than a few days, contact your doctor. Prompt medical attention can prevent complications and ensure a faster recovery.